in regards to carbs, what was your course kind of directing you to do as a practitioner when you graduated?
Well, I mean, any dietetics training is going to teach the guidelines. And so the guidelines are 45 to 65% of your calories coming from carbohydrates. This remains true for pregnancy.
Mm-hmm.
And for gestational diabetes, they additionally recommend that you not go below 175 grams of carbohydrates per day.
Right. Okay. And then just, you mentioned that, so after you graduated, did you go straight into working with pregnant women, or you mentioned you did an internship?
You do an internship first in order to become a registered dietitian. So that's about a year long. So that's the one at LA County USC Medical Center. I did see gestational diabetes while I was there, but not a lot because it was inpatient gestational
Mm-hmm.
diabetes work.
Mm-hmm.
So those are people who have been, for people who don't know, inpatient means like admitted into the hospital. So somebody who's having complications and is like in a hospital bed, right? So there was a little bit of gestational diabetes there. And it was, of course, as with any of the diabetes you see clinically in the hospital, really weird because it's like they're always trying to hit a minimum amount of carbohydrates. And it was like, why are we giving them a whole bunch of carbs when they have a blood sugar issue? What? But I started seeing gestational diabetes a lot more when I worked with the California Diabetes and Pregnancy Program and also clinically. So I was the sole dietitian for a perinatologist, so like a high-risk obstetrician who had specialized in gestational diabetes pretty much for most of her career. So for that area of LA, we saw almost every other provider would refer to us if they had a client with gestational diabetes. Mm-hmm. And so I was responsible for teaching the gestational diabetes class, for all the individual management. It was very fortunate that this practitioner and the whole practice was very nutrition forward. And so they really let me decide a lot of things. I mean, it was like the doctor sat me down when she hired me for the job and was like, you're responsible for their blood sugar, for their management. You're the one who decides if they go on insulin or medication.
Wow.
Which is like a big responsibility to put on a dietitian. Of course, they're available to consult, but they're like, we know we can do a lot with food. And I want you to do as much as you can with food before we go to medication.
That's incredibly progressive, really, isn't it?
Really progressive, actually. Yeah. And they also gave me the green light to like completely revamp their nutrition program, to completely redo their educational handouts. They're very open to research. I mean, we're associated with a teaching hospital. We had residents coming in. She was the chief of perinatology at that hospital specifically. And so when you have people who are like research focused and like work in teaching hospitals, they're more open to change maybe than people who have been, doing the same old for 40 years.
Yeah. So presumably when you started working with these women, initially you were using the guidelines to manage them.
Oh yeah. Because everything that I had been taught up to that point was that that's what you do.
Yeah, of course.
I was being a good little dietitian, you know?
And how long was it before you started to say, does anyone see what I see here? Like, this isn't working very well. How long did that take?
Yeah, not long, like months. Within months, I was changing things.
Yeah.
But yeah, I would go home every night from my job and research. I connected with a lot of other practitioners, some really forward-thinking clinicians like Dr. Jovanovic, which everybody knows for being really a champion for low carb and pregnancy. She was involved with the California Diabetes and Pregnancy Program as well. So we kind of worked, not together because she was in another part of the state, but we worked in the same organization. And when I heard that she was doing lower carb than the guidelines, I was like, whoa, okay, there's something to this.
Yeah.
And there is a lot of practitioners who were sort of like secretly doing low carb, but they wouldn't talk about it because the guidelines said you got to do a minimum of 175. But you'd sort of hear through the cracks, like, well, we went down to 150 grams of carbs. Well, we dropped, the bread from the meals. And so it was like this sort of
fascinating
like underground,
to have this stigma over, you know, not eating or just slightly reducing these foods that have become such an accepted part of our diet. You know, and it makes you wonder really about what's going on here, you know, that people feel like they'll do something, but then they have to be secretive about it.
Well, dietitians are very, very risk averse. People don't like to go against the guidelines.